Today I'm going to discuss a CAUTI, which is a catheter-associated urinary tract infection. A urinary tract infection, or UTI, is an infection involving any part of the urinary system. UTIs are the most common type of healthcare-associated infection reported to the National Safety Network. According to the CDC, among UTIs acquired in the hospital, approximately 75% are associated with a urinary catheter. Between 15 to 25% of hospitalized patients receive urinary catheters during their hospital stay. The most important risk factor for developing a catheter-associated UTI is prolonged use of the urinary catheter. Catheters should only be used for appropriate indications and should be removed as soon as they are no longer needed. The appropriate guidelines for using catheters include patients who have acute urinary retention or an obstruction, the need for accurate I&O in critically ill patients, perioperative use for selected surgical procedures, to assist in healing of open sacral or perineal wounds in incontinent patients, patients who require prolonged immobilization such as spine surgery or pelvic fractures, or to improve comfort for end-of-life care patients. According to the ANA, more than 560,000 patients develop CAUTI each year, leading to extended hospital stays, increased healthcare costs, and patient morbidity and mortality. Nurses play a major role in reducing CAUTI rates to save lives and prevent harm. Many CAUTIs may be prevented with recommended infection control measures. Nearly 50% of surgical patients remain catheterized beyond 48 hours post-operatively, and in the medical patient population, approximately 50% of patients do not have a clear indication for indwelling urinary catheters. Catheters may be inappropriately retained for days because of convenience, misunderstanding of their necessity, or a lack for clear orders to remove. Some examples of inappropriate uses for indwelling catheters include incontinence, or as a means of obtaining a urine specimen in a patient that can voluntarily be void, or for a prolonged postoperative duration without appropriate indications. Catheters should be removed by post-op day 2. Avoiding unnecessary urinary catheter use is the most important goal in CAUTI prevention. The new focus is based on the well-known fact that bacterial colonization can result in a hospital-acquired infection, which is an infection that the patient did not have on admission and that may have been preventable by following generally accepted guidelines. Urinary catheters are commonly left in place when no longer needed. In most hospitals, 4 steps are required to remove a catheter. First, a physician recognizes the catheter is in place. Second, the physician recognizes the catheter is no longer needed. Thirdly, the physician then writes the order to remove the catheter. And lastly, the nurse removes the catheter. Often, hours and sometimes days may pass before an unnecessary catheter is recognized and even removed, because every additional day of urinary catheter use increases the patient's risk of infectious and non-infectious complications related to the catheter. Interventions that facilitate prompt removal of unnecessary catheters have a strong impact. The implementation of evidence-based practice CAUTI bundles consist of educational interventions to improve appropriate use and clinical skill in catheter placement, nurse-driven removal protocols, and the use of bladder scanning. In my facility, we have the orange sticker here, which is something that we place on the chart daily. The physician will address it to see if the patient still needs the catheter. We have all the guidelines listed here. He can continue, either say discontinue the Foley catheter or to continue, and watch which indication is for that patient. We also have a nurse-driven protocol that we may remove Foleys without a physician order. And we have CAUTI champions on our unit. This person is a person who is assigned for each unit, and they are there to be a resource person for other staff members that if they have any questions or concerns about catheters. The infection control nurse also completes monthly audits on our catheter use, on how we maintain our catheters, and how well we are completing our documentation on these. The most important CAUTI prevention strategy after placement of the catheter is to maintain awareness of the catheter's existence. Not all CAUTIs are preventable, but we must be accountable for providing the best possible nursing care for our patients. Remember to assess your catheter daily, know how long they have been in place, and reassess if the catheter is still indicated.